In this video, you'll get a quick overview of Vibrant's Foundation Zoomer. I'll walk through each section of the test, highlighting key features. Then I'll explain the technology used and briefly discuss the collection instructions. I'll also suggest synergistic tests and end by highlighting the Vibrant Advantage and where to go for additional information. Vibrant's Foundation Zoomer gives you a grounded starting point for understanding whole body health. It shows how key systems, including cardiovascular, metabolic, hormone, and immune response, relate to one another and where imbalances may be building. These insights help shape a roadmap that you can use to guide care with more intention and less guesswork. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The Foundation Zoomer report includes a cover page, an index, an introduction, a summary with marker interpretation, including educational infographics, then ends with a list of all the markers. Let's dive in. The cover page identifies the sample type and includes the results interpretation key. The index lists the 13 sections of the report, including Foundation Zoomer summary, liver health, kidney health, nutrition health, blood cell health, hormone health, cardiovascular health, musculoskeletal health, neural health, gut health, immune health, skin and hair health, and energy health. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page, especially if you want to learn about the methodologies used or how reference ranges were established. The Foundation Zoomer report begins with a comprehensive summary page that provides an integrated overview of the patient's overall health status across core physiological systems. The summary highlights system-level health scores on a standardized 100-point scale, categorizing results into risk tiers to help prioritize clinical attention. Key domains assessed include energy, neural, cardiovascular, hormonal, metabolic, immune, gut, nutrition, blood cell, skin and hair, musculoskeletal, and organ function, i.e. the kidney, liver, and pancreas. These scores are visually mapped into a full-body anatomical illustration, allowing for intuitive visualization of system-specific imbalances and their relative severity. The next page of the summary shows the out-of-range results. This is followed by infographics starting with liver health. The liver health infographic shows the stages of liver disease, starting with the reversible progression from healthy liver into a fatty liver, and then from a fatty liver into a scarred and hardened liver, also reversible, and then from a scarred and hardened liver into a scar-forming liver, which is hard to reverse. Note the liver health markers that are out of range populate below the infographic. There's also a kidney health infographic, helping providers explain kidney function to their patients. Again, out-of-range markers populate below this infographic. The next infographic, the nutrition health infographic, shows where nutrients undergo metabolic processing and how each nutrient impacts various organs and biological systems. The blood cell health infographic shows the classification for each marker, making it easier for providers to explain red blood cells versus white blood cells to patients. The final infographic is for hormone health. It's so big it prints sideways on the 8.5 by 11-inch page. This shows how each hormone is made and which organs or tissues are impacted. The Foundation Zoomer ends with the levels of all markers, including nutrition health markers like vitamin B12, folate, and homocysteine. Hormone health markers like estradiol, progesterone, testosterone, sex hormone binding globulin, and a full thyroid panel, including TSH, T3, T4, reverse T3, along with anti-TPO and anti-TG to investigate autoimmunity. Also, blood cell health markers like hemoglobin and hematocrit. The blood cell health category also includes platelets and white blood cell health markers like lymphocytes, monocytes, eosinophils, and basophils. Metabolic health markers like fasting glucose, fasting insulin, leptin, adiponectin, and HOMA-IR. HOMA-IR is a calculated index combining fasting glucose and insulin, reflecting the degree of insulin resistance, not glycemia alone, and is useful for tracking trends over time and response to intervention. The kidney health markers, like GFR, uric acid, and cystatin C. Cystatin C is a protein produced by all nucleated cells and filtered by the kidneys. Since it's less influenced by muscle mass, age, or sex, it helps clarify kidney filtration when creatinine is ambiguous. Liver health markers like ALT, AST, and GGT. GGT is a marker of detoxification demand and oxidative stress. It responds to alcohol, medications, environmental toxins, and bile flow, and it's frequently elevated before other liver markers change. The cardiovascular health markers include total cholesterol, HDL, LDL, triglycerides, and hs-CRP, but also ApoB, which represents the number of atherogenic particles, small dense LDL, which more easily penetrates the endothelium, stays in circulation longer, and signals a metabolic-driven atherogenic pattern, Lp(a), a genetically predetermined LDL-like particle that increases thrombosis, inflammation, and plaque formation, PLAC, also known as plaque, an enzyme released by activated macrophages within plaque that tells you what the plaque is doing, not just whether it exists. Also MPO, a marker of oxidative stress and immune activation. TNF-alpha, a central mediator of inflammatory signaling, immune activation, and insulin resistance, often elevated in chronic immune stimulation. And interleukin-6, a key upstream cytokine driving CRP production and systemic inflammation. Also, musculoskeletal health markers like vitamin D, alkaline phosphatase, and parathyroid hormone. Along with insulin-like growth factor 1, as IGF-1 reflects the body's willingness and ability to invest energy in growth, repair, and regeneration of musculoskeletal tissues. The neural health markers include vitamins B12 and D. The gut health markers include antizymulin, actin, and lipopolysaccharide, aka LPS, which provides insights on intestinal hyperpermeability. The immune health markers includes total IgG, total IgM, rheumatoid factor, and anti-CCP3. Anticyclic citrullinated peptide antibodies are autoantibodies that target citrullinated protein fragments. Citrullination is a protein modification that occurs in inflammatory environments and can trigger autoimmune recognition. Therefore, anti-CCP antibodies, particularly IgG, are considered highly specific markers for inflammatory arthritis, most notably rheumatoid arthritis, and help distinguish it from other forms of arthritis. Also, skin and hair health markers like DHEAS and free testosterone. And finally, the energy health markers, which includes vitamin B12, ferritin, hemoglobin, and transferrin saturation, which provides insight on oxygen delivery to cells, along with hormones like cortisol, DHEAS, TSH, and free T3. Results are reported as both a number and plotted graphically, so you can visually see how high or low your patient's results are. Results are displayed in a quantile-style format using horizontal bars segmented into dark green, optimum, green, in control, yellow, moderate, and red, risk zones, positioning the patient's value as a pin to intuitively convey relative risk levels. Note the patient's value is considered normal if it falls within the dark green optimum or green in control zone. When you order a repeat foundation zoomer on the same patient, current results are indicated by a dark blue pin, and previous results are indicated by a light blue pin. In this example, the patient's level of ferritin increased from less than 3 to 51 after they started eating red meat, cooking in cast iron, taking a ferrous bisglycinate supplement, and some traditional Chinese medicine herbs to build blood. Now let's talk about methodology. The foundation zoomer uses liquid chromatography tandem mass spectrometry, or LC-MS-MS, for detecting reverse T3. The foundation zoomer uses multiplex chemiluminescent immunoassay, aka CLIA methodology, to measure immune reactivity to the gut barrier integrity antigens zymulin, actin, and LPS. This is a semi-quantitative assay that detects IgG, IgA, and IgM antibodies in human serum. For anti-CCP, Vibrant uses the ELISA methodology. That stands for enzyme-linked immunosorbent assay. The testing method for ANA is an indirect immunofluorescent assay, or IFA, manufactured by the Euroimmune and performed on the FDA-approved Europattern system. Finally, for all other markers, Vibrant uses the FDA-approved Roche Cobas platform. Finally, let's review the collection process and key preparation considerations for foundation zoomer testing. Vibrant's foundation zoomer is a blood test. Blood is collected via blood draw, usually done by a phlebotomist. And note, 4 tubes are required. As for timing and pretest conditions, patients should schedule their blood draw in the morning after an overnight fast. Fasting is recommended, and the collection instructions say to not eat or drink for at least 8 hours before collection. For optimal and clinically relevant results, patients should maintain their routine diet, medication, and supplements unless specifically instructed otherwise by their healthcare provider. As with all testing, patients should consult their healthcare provider before making any lifestyle changes, including changes to prescribed medications, dietary restrictions, or supplements. Before I share synergistic tests, I'd like to introduce you to Dr. Sydney Baker's Tack Rules. Rule number 1. If you're sitting on a tack, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 tacks, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. Therefore, in addition to Vibrant's Foundation Zoomer, also consider the Gut Zoomer, which identifies microbiome imbalance, gut inflammation, and barrier dysfunction that may be driving systemic immune activation, metabolic disruption, or nutrient deficiencies seen on the Foundation Zoomer. Also, Hormone Zoomer, which provides a comprehensive assessment of cortisol and sex hormone patterns to clarify whether metabolic, mood, or cardiometabolic findings on the Foundation Zoomer are hormonally driven. Also consider the Toxin Zoomer, which evaluates toxic burden that may be contributing to inflammatory, metabolic, or organ function abnormalities. And finally, the Nutrient Zoomer, which assesses intracellular micronutrient status to determine whether foundational metabolic, immune, or organ markers are being impacted by suboptimal nutrient availability. In summary, Vibrant's Foundation Zoomer provides a system-level baseline of how the body is functioning as a whole. Instead of fragmenting care across isolated labs, it shows how metabolism, cardiovascular health, hormones, immunity, inflammation, nutrient status, and organ function interact, revealing where stress is building and what deserves attention first. The Vibrant advantage is that the Foundation Zoomer connects metabolic, cardiovascular, hormone, immune, nutrient, and organ signals in one coordinated baseline. This enables a clear clinical starting point when where do we begin isn't obvious. It allows for faster prioritization of follow-up testing and care pathways with less trial-and-error decision-making, and more confident patient conversations grounded in systems-level biology. To learn more, visit the links in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.